Good afternoon, everyone. This is Tiffany Davis from the Silver State Health Insurance Exchange, and we're just waiting for our board members and a few others to join us today. Thank you for your patience. Welcome, everyone. Tiffany Davis for the record. We're just waiting for a few more to join us before we get started. Thank you.
Greetings, everyone.
Good afternoon, Madam Chair.
Good afternoon. And it is wonderful to see you in your new role as Executive Director. And
Thank you. I'm pleased to be here. Oh, I didn't mean to cut you off. Sorry, madam.
Oh, how are you doing?
I'm doing well. I had hoped to join you from my palatial new director's office today, but unfortunately, my family and I are a little bit under the weather, so I'm joining you from home today. But very pleased to be here and grateful for the opportunity.
And we are blessed to have you, as well as the rest of our amazing staff.
Well, we're all pleased to be here. I'm going to ask for your patience today and to please bear with me. This is my first time facilitating one of these meetings. And while Tiffany spent a great deal of time prepping me for it, I may still have some questions along the way. So your patience and understanding is appreciated.
Well, looking at the agenda, it looks pretty straightforward today. So I don't think there'll be any hurdles, and your report is excellent.
Well, thank you. If we're ready to begin, I'm happy to initiate the roll call at any time, Madam Chair.
And who would know, Tiffany, who would know if we have our quorum?
Madam Chair, I have been monitoring who has joined us, and so far it looks like we have a quorum, but then Russell Cook, after he does roll call, will confirm that.
Oh, excellent. Well, then our Chief Executive Director, Russell Cook, would like to call the meeting to order and welcome everyone. And thank you very much for making time in your very busy schedule to join us today for our board meeting. We'll go ahead and proceed with roll call and any announcements.
Thank you, Madam Chair. I'll begin the roll call now. Dr. Florence Jameson.
Present.
Wonderful. Ms. Valerie Clark. Ms. Valerie Clark, I thought I saw you on the roster here.
Russell, it looks like she's just joining again.
I see. Okay. Oh, there you are. Ms. Valerie Clark. Wonderful. We'll mark you down as present. Ms. Levon Lewis.
Present.
Wonderful. Dr. Sarah Friedman. Dr. Sarah Friedman.
Present.
Present. Thank you. Mr. Jonathan Johnson.
Present.
Oh, that one.
Mr. Quincy Branch. One more time, Mr. Quincy Branch. I will mark Mr. Branch as absent. Ms. Stacy Weeks.
Here.
Good afternoon, Director. Commissioner Kipper.
Here.
All right. Thank you for joining us. And Ms. Teresa Bodden. Ms. Teresa Bodden? I will be marking Ms. Bodden as absent for today. All right. I wanted to give a few custodial reminders up top here to please keep yourself muted if you are not the one presenting or making a comment at the moment. And for those on the phone, please remember to mute yourselves or else we will be able to hear your private conversations. So now that we've completed the roll call, Madam Chair, I do believe we have a quorum.
Dr. Jameson, I believe you're muted. My apologies.
Public comment time. Do we have any public comments in the north or in the south?
Dr. Jameson, Tiffany Davis, for the record, I'm happy to assist with public comment due to a few new changes in the open meeting law. There are some specific directions that we do need to provide for public comment. So I'm happy to go over that at this time. So for anyone who has joined us on our Zoom meeting or has called in, just as a reminder, if you would like to make public comment, please raise your electronic hand or indicate in our chat box if you would like to make a public comment, and then you will be called upon to make that public comment. So to start things, though, I will start with our conference room in our conference room in our Carson City office. And there we have Cassie Fuentes in that location. Cassie, is there anyone in our physical location that would like to make a public comment?
Cassie Fuentes, for the record, there are no public comments here in the Carson City location.
Thank you so much for confirming that, Cassie. And then online, if we have any attendees who would like to make public comment, once again, you can raise your electronic hand feature on the Zoom, and then Caitlin will call your name and you may unmute yourself to make public comment. Caitlin, do you see anybody who would like to make public comment at this time?
Caitlin Blagan, for the record, no, I do not see anybody online to make a public comment.
Okay, and then I know that I also want to acknowledge there may be somebody who has called in. If there's anybody calling in on the phone lines, if you would like to make a public comment, go ahead and unmute yourself at this time and present your public comment. Caitlin, maybe you can see if there's anybody who may do that.
Caitlin Blagan, for the record, I do not see anybody at this time.
Thank you for that confirmation. Madam Chair, does not look at this moment that we have any public comments.
Thank you, Tiffany. And then going on, item number 3 on our agenda, approval of the minutes of the July 31st, 2023 board meeting. Having reviewed them, I would like to ask our board if they would like to make a motion to approve those minutes.
Jonathan Johnson, motion to approve.
Thank you, Jonathan. And do we have Thank you, Ms. Lewis. And at this point, I'll ask if anyone has noted during the review of the minutes of July 31st, 2023, any omissions, any edits you care to make, any corrections or additions? I would like to thank our staff for the excellent minutes and everybody in favor of approving those minutes. If you just say aye or
Aye.
I,
is there anyone opposed to the minutes? Anyone abstaining? The minutes for July 31st, 2023 board meeting are approved. Thank you. And now the exciting executive report by our new executive director.
Thank you, Madam Chair. Russell Cook for the record. It's my understanding that in the past, the executive director's reports have been read in full. I wanted to ask if it might be all right if I summarize certain portions of the report. In particular, I wanted to allow some time as we go through each section to address any questions that the board might have along the way to make sure we don't lose track of any of those questions and to make sure that any questions you do have are addressed during this meeting. So, Mr. Detmer, does that sound like that would be acceptable, or is there a requirement that I read the report in full?
Mike Devon for the record. I think that would be fine as far as conducting the meeting in the manner and method in which the commission decides. The question will be as to whether or not the report itself becomes support material.
The report is very organized, beautifully organized and quite concise. I don't think that it would be too much considering the amount of material we have in the meeting if you do want to read it with vigor for all board members, just in case any of them have not had an opportunity to thoroughly review and study it.
That sounds great, Madam Chair. Again, Russell Cook for the record. I'll start with the section titled General Comments. Since I assumed the executive director role on August 14th, the exchange has experienced an unprecedented volume of challenges as well as numerous opportunities for growth. In my experience, the agency-wide workload is at an all-time high, but I also believe that the adversity posed by 2023 thus far has strengthened the resilience of our staff while substantially increasing the maturity of the exchange as an ACA administering entity. As we prepare to embark upon our 5th open enrollment period as a state-based marketplace, it's my privilege to direct a team whom I believe to be the most knowledgeable, capable, and compassionate staff to serve the exchange to date. Next, I wanted to provide an update on some recent changes in terms of our staffing. This is the section titled Personnel Updates. SS Hicks has made great strides over the last few months in terms of filling key staff vacancies. On September 18th, we welcomed Brooke Mills, who previously served as the exchange's health resource analyst, to the policy and compliance manager position. On the same day, Max Borgman, who most recently worked as an IT manager for the Department of Taxation, began work as the exchange's new information systems manager and information security officer. So that was my old role. Cassandra Fuentes joined our Carson City staff as administrative assistant on September 5th, and Michelle Fazio Gardea will join our Las Vegas office as administrative assistant on the 16th of October, on this coming Monday. At present, the exchange only has 3 remaining vacancies: 1 position on our reconciliation team, 1 position on our QA team, that's our quality assurance team, and Brooke's former position as health resource analyst. Each of these positions is currently listed on the state's job recruitment website, and we anticipate having each of these positions filled before the end of the year. And it's been quite some time in my recollection since we've been at full staff, so really looking forward to achieving that goal. Let me pause right there. I'm just going to pause briefly if it's okay after each section. Again, I want to grab questions in line if possible. Any questions from the board regarding the personnel updates? All right, I'll keep moving along.
And I would just comment that I like the idea of the questions in each section. And I would like to tell you, I'm very excited about the 5th open enrollment, and that I congratulate you on being able to fill these positions, especially your job. These are very unique positions, and I don't think our state or across the country really businesses have had a harder time filling positions with qualified candidates. And I just think it's great that you have been able to fill your old position as well as some of the others. And I have great hope then that you may come close, if not fill all the positions. So great job.
Thank you, Madam Chair. Russell Cook again for the record. That's certainly our goal, but I appreciate the kind words. I wanted to move next to an update regarding our fall marketing campaign. The marketing and outreach update, which I believe is the next agenda item, will provide a detailed overview of this fall's marketing strategy. But it's important to me to commend our communications officer, Katie Charleston, for her tireless work in collaboration with our partners at the Abbey Agency. Throughout the year, Katie has frequently voiced her desire to develop a campaign aimed at a diverse and representative population of citizens, which also embraces Nevada's rural counties. And I think she's done an exemplary job of steering the marketing team towards that goal. I also wanted to highlight the extraordinary work of the Abbey Agency, who not only worked with Katie to develop the concepts for the campaign, but also managed the production of some truly world-class content. I've had the pleasure of working closely with their team on a weekly basis, and I not only consider them to be excellent business partners, but also valued members of the exchange team. And I wanted to mention on a personal note, a couple of weeks ago, I had the pleasure of attending a media training. We also did some headshots and a video shoot up in Reno. And Alexis and Bridget from Abbey Agency actually flew up to Reno to assist with that. And while it is normally a bit off-putting for me to have so much attention paid to me in one day like that, I really do feel that I benefited greatly from that. And I just wanted to share with the Abbey Agency that on that day, I finally felt like I had, completely assumed the appropriate confidence level for this position. Started to feel very directorial after that. So just want to thank you for the opportunity. Again, I want to pause briefly here. You're going to have ample time, I believe, to raise questions with Katie or the Abbey Agency about the marketing campaign, but I just wanted to pause here, give you an opportunity to share any questions.
I agree. We'll have ample time after their presentations. Thank you for your kind words for them.
Wanted to shower them with a bit of well-deserved praise there. So I'll move on next, Madam Chair, to the issuers and plan offerings for 2024. The exchange is pleased to welcome 2 new health issuers, Imperial Health Plan and Molina Healthcare, to the marketplace for plan year 2024. This brings the statewide total of health issuers up to 8, offering a combined total of 163 different qualified health plans through Nevada HealthLink. Rating Area 1, which is Clark and Nye counties, and Rating Area 2, which is Washoe County, saw a net increase in the number of participating carriers owing to these new carrier entries. Rating Area 3, which is Quad counties, saw no net change in the number of carriers. But Rating Area 4, which is comprised of Nevada's rural counties, did see a net decrease from 3 to 2 participating issuers, owing to the decertification of one of our issuers, Friday Health Plans, and I'm going to provide some more details about that in the following section. The statewide number of dental issuers offering qualified dental plans through Nevada HealthLink holds steady at 5, with a combined total of 18 QDP offerings and no net change to the number of participating issuers in any of Nevada's rating areas. I feel that it's important to highlight the efforts of Megan Ranson, our plan certification manager, and Kayla Jost, our reconciliation team lead, for their tremendous efforts in onboarding our new issuers. I know from experience that bringing even a single issuer to market is a tall order, and their work will translate to a substantial increase in marketplace choices for the majority of Nevadans. Again, I'd like to pause for any questions about the issuers and plan offerings. All right. Hearing nothing.
I would just like to congratulate everyone. It's very exciting. At one point, we were down to slim and few participants, especially in the rural area. So I just want to give a special welcome from myself, the chair, as well as our board, to Imperial Health Plan and the Molina Healthcare to our marketplace plan year for 2024. And thank you also to Megan Ranson, our plan certification manager, and Kayla Jost. It's very, very wonderful to have this growth and expansion.
I have a question. This is Jonathan Johnson. The 2 carriers that remain in the rural areas, do you know which ones those are?
Oh gosh, it is Silver Summit, and if you can give me just a moment here, I will be able to look that up here. And I'm so sorry I didn't have that handy, but I do have a cheat sheet. It'll just take me a moment. I'm on my laptop here and I gotta go get it.
All right.
And this
And-
is Russell Cook again for the record.
And I asked the question, right, just kind of seeing what happened with Friday Health Plans and the impact that has on folks participating in that plan and the disruption that that's meant, across the system. Yes, we don't want to get back to a point where we're struggling to find offerings in some of these areas. But just curious to, on these new carriers that are coming to market, what sort of process do they go through, or evaluation, so that we don't end up, kind of in that situation like we did with
And would that be possible after the, as it is part of this presentation, is Megan Ranson available to give a little bulleted summary with brevity and vigor on how she certifies these?
Madam Chair, this is Russell Cook for the record. If it's all right with the board, I'd like to try and address Mr. Johnson's question as best I can. I also did pull up my cheat sheet, so I wanted to share a bit of information. And then as long as it's okay, with Mr. Detmers, as long as we're allowed to do so, and as long as we have Megan on the line here, I would be happy to let her provide some additional detail about our certification process, but I'll share what I know momentarily and then see if Megan would like to correct or amend any of the information that I've shared. So I just wanted to circle back on the question about the issuers in rating area 4. And I do want to apologize if there's anyone from our partners at Anthem on the phone, because they, of course, offer plans in all 4 rating areas. They are the second carrier other than Ambetter, or they go by the brand name Silver Summit on the exchange. Those 2 carriers, Anthem and Silver Summit, are offering a combined total of 33 plan offerings for rating area 4. I also wanted to mention that Molina Healthcare, who's one of our new issuers, they're going to be offering plans in rating areas 1, 2, and 3, while Imperial Health Plan is going to be offering plans in both rating areas 1 and 2. So the statewide outlook is continuing to improve, and we're very pleased with those numbers. Wanted to address the next question, if I may, regarding the certification process. So the annual certification process is something that's conducted in collaboration and coordination with Nevada's Division of Insurance, and there is a kind of a clear delineation of duties and responsibilities there. On the exchange side, Commissioner Kipper, yes, please.
Good afternoon. For the record, Scott Kipper. And I just wanted to let everybody know that, when we're talking about Friday Health Plans, as well as the 2 new members that are joining the exchange this year, a full review of those plans' financial wherewithal has been undertaken and is also undertaken annually by the Division of Insurance. So that is, I believe, part of that annual certification process. But I just want to let everybody know that indeed we do look at those financials very carefully in the process.
Thank you, Mr. Kipper, for reassuring us after what has passed with regard to the Friday Health Plan. And we will look forward in a moment for the follow-up on that as requested by our board members. Go ahead.
Thank you, Madam Chair. Russell Cook for the record again. I believe the commissioner did a great job of summarizing the Division of Insurance's role in the annual plan certification process. And then I want to emphasize that is an annual process. All returning carriers are subject to the same verification and validation of their fitness to offer health or dental coverage in Nevada every single year. It's a month-long process. On the exchange side, we are primarily focused on ensuring that the plan offerings are consistent with ACA regulations regarding essential health benefits, and that they meet the minimum standards for care, both for health plans as well as dental plans. You know what, Ms. Weeks, I'm sorry.
Yes, we have one more hand up. on, I apologize, I just saw myself.
Okay,
Go ahead.
Stacey Weeks for the record. My hand there kind of blends in with the white wall, so I apologize. I just wanted to give a little bit of context to, I think, how our Medicaid program impacts the plans on the exchange. We require all of our MCOs to be in the exchange. So we currently have 4. Before we had 3. That contract ends in 2025. So just kind of pointing out, we may or may not have that many plans in the future. Just want to be aware of that. And then also, you never know, things change. But also wanted to give some context that we are doing statewide managed care. So a lot of our plans are going to need to offer products that can meet rural needs. It's something we're working on now, and we would require those plans. I mean, we're thinking right now, looking for feedback as well from obviously this group, but thinking about requiring those plans in the rural areas to also offer an exchange product to, if they're able to serve Medicaid, then we should be technically, I would assume, be able to serve the individual market and exchange as well. So just something to think about, as we move forward with our contracting. I think it does impact some of the availability on the exchange.
Thank you so much. And I know it is a challenge for many of the entities to be able to offer to the rural area. And we are very grateful for Anthem and Silver Summit for doing so to date. It'll be interesting to see if some of your requirements can create more participation.
Madam Chair, Russell Cook again for the record. I wanted to elaborate a bit on some of the comments from Ms. Weeks before I go back to Mr. Johnson and make sure that we've answered his questions satisfactorily. The requirements that Ms. Weeks mentioned about MCO providers offering plans on exchange, we're very excited about that because that is something that has helped other states to improve the conversion rate of individuals who are transitioning off of Medicaid coverage and on to exchange coverage. It also at least presents the possibility of us moving in a direction, potentially one day. There's a lot of milestones to accomplish in the meantime, but there are other states in the country that are doing auto enrollment. So they are actually transitioning these consumers in certain cases, particularly when they qualify for zero net premium exchange coverage, they can actually transition them from Medicaid coverage to exchange coverage in a comparable or in some cases identical plan with the same provider network in place. So looking towards the future, and I know that's maybe a couple of years down the road, we're hopeful that that's going to improve our ability to work in close coordination with Nevada Medicaid to ensure that these consumers have a minimum of trouble kind of navigating that transition, which right now there are, despite our best efforts, a number of hoops that they have to jump through to get enrolled on exchange. So with that being said, I wanted to circle back to Mr. Johnson. Did we answer your question satisfactorily? We do have Megan here, and I'd be happy to ask her to elaborate a bit if we didn't provide enough detail.
That's perfect. Thank you.
Very good. All right. If it's all right with the board, I'm going to move on to the next section of my report. Again, Russell Cook for the record. This next section is about the decertification of Friday health plans. Friday Health Plans, one of 7 health issuers to offer plans through Nevada HealthLink during the plan year 2023 open enrollment period, was placed under a court-ordered receivership in June as a result of insolvency. The receiver, working in collaboration with the Nevada's Division of Insurance, assessed that Friday would likely be unable to continue paying claims beyond the month of August. SSX was therefore instructed to decertify Friday Health Plans and terminate all of their active enrollments with coverage ending August 31st. This operation had the impact of ending marketplace coverage for approximately 2,700 enrollees who were enrolled at that time with Friday Health Plans. Prior to terminating these enrollments, SSX and our technology vendor Get Insured developed a mitigation plan in early August, which involved the automatic creation of a special enrollment period through October 31st for all impacted enrollees. Targeted instruction to our broker and navigator communities, as well as a direct-to-consumer outreach campaign orchestrated by the SSX call center. The primary goal of this plan was to support the active re-enrollment of impacted consumers with a different issuer in their service area. And when I say active in re-enrollment, what I mean is that unfortunately it was necessary for these consumers to take action and actually enroll themselves or get re-enrolled with the assistance of an enrollment professional with a new issuer. We just don't have the authority to do that for them. So I just wanted to clarify the meaning of in that context of active re-enrollment. I'll continue. In spite of the extremely unfortunate circumstances of this occurrence, I consider this mitigation plan to be a resounding success. As illustrated in the following chart, which is included in the report, approximately 2/3 of impacted enrollees re-enrolled with a new issuer before their previous coverage lapsed on August 31st. And to date, a total of more than 72% of impacted enrollees have re-enrolled with a new issuer. And I believe much of the credit for this success is due to the work of Shay Herbert and her quality assurance team. Shay has personally spoken with a substantial number of the impacted consumers, including several consumers from rating area 4 who were most heavily impacted by Friday's departure from the marketplace. Her work has ensured that the most severely impacted enrollees were provided with the best possible customer service, even if the best option for some of these consumers was an off-marketplace plan offered through the individual market. And I just wanted to again call out Shay's efforts here. I lost count of how many hours she spent on the phone with these individuals, but the particular example that I had mentioned here, or one particular example from rating area 4 involved a consumer who was receiving treatment for a life-threatening condition and already had specialist procedures scheduled for the month of November. And it turned out that that particular specialist was not in the network of Anthem or Silver Summit. And Shay was able to help this consumer find an off-exchange plan that would allow her to continue receiving her treatment through the end of the year. So that to me is just exceptional. It's really what we strive to do here. And I was thinking of that work in particular when I use the word compassionate in the opening paragraph. That to me really exemplifies what the kind of service that I hope we can always offer to our enrollees. Any questions about Friday health plans? I did want to mention there is a chart in the report. The main point I wanted to highlight by including the chart is that the vast majority of these re-enrollments happened in the weeks immediately following the implementation of our mitigation plan, which again, I continue to be very successful. So while we've only managed to actively re-enroll about 3/4 of the impacted individuals on the exchange, as I mentioned, we've confirmed that a number of these individuals were able to find coverage off exchange as well. So, across the board, we do consider this to be a success. Would be happy to entertain any questions right now or provide any more details about the entire process if desired.
So the chart, the graph actually will include those re-enrolled within our own exchange, as well as anyone that just re-enrolled, so that we saw everyone that got insured again. Or it's just the chart, it's just those within the exchange that re-enrolled within the exchange.
The latter, Madam Chair. Russell Cook,
Okay,
for the record. Yeah, but the data that we only have access to the data in our own system, and so we just don't have the ability to access data for re-enrollments on the individual market off exchange. So we're just trying to do the best we can to illustrate what we've been able to accomplish within our own system. Commissioner, I see your hand raised. Please go ahead.
Yes, thanks, Madam Chair. For the record, Scott Kipper. And I just wanted to say how much the division appreciates the work of the staff at the exchange. It was a terrific collaboration as we worked through the receivership and liquidation of making sure that those who were affected had a soft landing spot within the exchange, or the work that those consumers got to find healthcare and health insurance elsewhere. So I just wanted to say how much we at the division appreciate the staff work done by the exchange.
Thank you, Mr. Kipper and Scott, sorry. And I just wanted to know, this is a great report. And of course, we would also be interested in knowing if it was a beautiful story about the one particular person who had a very specialty provider that was able to also be taken care of. Were there any unfortunate outcomes that were a problem for some of our prior enrollees?
Thank you for the question, Madam Chair. Russell Cook for the record. Unfortunately, there were many stories of adverse impact on consumers. I think the across the board, the biggest issue that these consumers faced was that their accumulators were starting over with their new issuer. So any contributions that they had made to their deductible or to their max out of pocket, many of these consumers who were receiving treatment for serious conditions had already reached their max out of pocket for the year. So there were a significant number of consumers, unfortunately, who were adversely impacted, in a financial sense. But our call center made every effort to reach each one of these folks individually. We also were receiving numerous referrals each week from the governor's office, from congressional delegates, also as a result of media inquiries. I don't think we've ever received so many media inquiries in so short an amount of time as we did during the month of August. All things considered, I think that the collaboration that the commissioner spoke of, really improved the outcome for a lot of these folks. But at the end of the day, it was a very unfortunate situation, and there were limits to what we could accomplish with that collaboration. I hope that answers your question, but I'd be happy to provide more details if you'd like.
It did answer my question. I really hadn't thought about that issue, and it is unfortunate. And certainly we are very apologetic for these emotional and financial inconveniences that occurred to these previous customers. Please continue.
Thank you, Madam Chair. Russell Cook again for the record. And I did just want to take another moment to single out the work of our technology vendor, Get Insured. In my opinion, the solution they came up with in a very short amount of time contributed to the success rate of getting these individuals re-enrolled. When I say that they created an automatic special enrollment period, what I mean is that when these individuals logged into their consumer portal after their Friday policies had been terminated, they did not have to upload supporting documentation. They did not have to provide any information about their loss of coverage, which normally is a qualifying life event that would have to be self-reported, and there would be a validation process afterwards. So I believe that their solution, which they came up with and implemented in less than a week, was able to make that process a lot easier. So I just wanted to commend them again if there's anyone from Get Insured on the line for their efforts. I'll move on next, Madam Chair, to an update regarding annual renewals. Next week, the exchange will run its annual passive renewals job that's currently scheduled for October 18th, which will attempt to renew all active 2023 enrollees into 2024 coverage. As of the 2nd of October, SS6 had 82,385 active health enrollees and 14,616 active dental enrollees, of which 12,615 were enrolled in both health and dental coverage, for a total of 84,386 unique individuals. Based on our staged renewals run last month, every year we kind of rehearse the renewals run in the weeks prior to the actual production job. But based upon this run last month, we anticipate passively renewing at least 90% of those enrollees, or at least 74,000 health enrollees and approximately 13,000 dental enrollees into 2024 policies. And I believe that's a conservative estimate. I believe based upon corrective action that's been taking place in the exchange system up until this very week, that number is going to be closer to 93 or 94%. But even at the conservative level of 90%, that would put us over 74,000 re-enrollees. And just for reference, last year there were, I believe, approximately 76,000 passive health re-enrollees. So we're really not far off that mark from last year, looking to be holding steady. We did, by the way, see just shy of 20,000 new enrollees last year, and we anticipate a similar number this year. So all the signs are pointing towards an open enrollment whose success is going to be comparable to last year's in terms of enrollment numbers. We will, of course, look forward to providing you with a retrospective report, though, after the conclusion of open enrollment. Did want to clarify also, you may be wondering, well, why only 90 or 93 or 94%? And that's because there are a variety of eligibility related reasons why an individual might not be passively renewed. Among the most common of those issues would be overlapping coverage due to simultaneous Medicaid enrollment. But we do each year also re-verify lawful presence, and we re-verify incarceration status. There may also be some individuals who were deceased during the year and now have a death indicator present with the Social Security Administration. So there are a variety of reasons why we can't just automatically renew every single enrollee into next year's coverage, but we do anticipate that the vast majority of consumers will be renewed. I'll pause there and take any questions about the annual renewals process. All right, if there are no questions, I'm happy to proceed with an update about our broker certification process. Wow, over 900 brokers and agents have entered SS6's plan year 2024 certification curriculum, an all-time high for SS6 by a good margin, I believe, including over 200 new brokers who have not previously offered enrollment assistance through Nevada Healthing. And I think that's a heck of an accomplishment. I believe this success is directly attributable to the efforts of Rebecca Lamazzo and the SS6 broker team. The broker team has not only developed a comprehensive certification curriculum, which ensures that our brokers are equipped to offer the best possible enrollment assistance, but they also provide constant support to the broker community throughout the year by phone, by way of our broker support inbox, and through our monthly broker newsletter. And I did want to mention briefly that I had the pleasure of speaking at a luncheon for the Northern Nevada Association of Health Underwriters. Actually, they're called NABIP now, but not NAHU anymore, but it is the same organization. And the feedback, the positive feedback that I received from these agents and brokers regarding our broker team and their efforts, and Rebecca's efforts in particular, just was overwhelmingly positive and filled me with a great deal of confidence. So just wanted to share with you that this is not only my assessment, but I believe that assessment is shared by our entire agent broker community. So I really want to commend that broker team for their efforts. Also noteworthy is a new process for completing the annual certification or recertification process. SS6's Deputy Attorney General recently suggested that the exchange's previous process, which involved gathering attestations to the terms and conditions of exchange certification directly through our online curriculum, might not constitute a legally binding agreement. We weren't actually capturing a signature through that e-learning curriculum. And as a result, we developed an explicit broker agreement document. And over the past 4 weeks, I guess 5 weeks now, we've been pilot testing an official signature gathering process using DocuSign. Thus far, the effort has been a resounding success. As of Monday, we had 640 brokers or agents having signed their broker agreements. And in the future, we hope to implement a similar process for Navigator and in-person sister agreements, and perhaps also for our annual issuer agreements. This pilot test has gone well. At the luncheon yesterday, we got nothing but positive feedback from the agent broker community regarding this process. And I believe that this has been, a subtle but important, step towards the further maturation of these processes internally. So I'm happy to pause now and take any questions. All right, we'll keep rolling along. Next is an update regarding Medicaid unwinding, and I apologize. I'm going to have to silence my notifications here. Hope that's not too distracting. This is a brief update on an immense topic, and so I will, certainly be happy to provide additional details at the end of this paragraph. I also wanted to acknowledge that Director Weeks has a lot more information in this area than I do, and I wanted to be really careful to stay well within our lane at the exchange and share some information from the exchange's perspective. So if there are any additional details requested at the end of this update, Ms. Weeks, I hope you don't mind if I ask you to share some additional information. I would also be happy if you'd like to share some additional clarification or additional color of your own once I'm done. So I'll get through my paragraph and we'll circle back on that in a moment. While Nevada's unwinding effort continues its steady progress, recent developments related to the Division of Welfare and Supportive Services redetermination process have resulted in the need to reinstate Medicaid or CHIP coverage for a significant number of Nevadans whose coverage was previously terminated for procedural reasons or failure to respond by mail to a request for additional eligibility information. This is often referred to as the Medicaid packet. While consumers terminated for procedural reasons are not referred electronically to the exchange, we only receive electronic referrals following terminations for verified excess income. A small number of these consumers who did receive the procedural terminations did actively enroll in marketplace coverage between May and September, and we are currently working with DWSS as well as DHCFP to identify which consumers impacted by the reinstatement will need to have their marketplace coverage canceled or terminated. Once these consumers have been identified and their Medicaid or CHIP enrollment status has been confirmed, SS6 will take the appropriate corrective action to correct their marketplace enrollment status while ensuring that these individuals do not experience a retroactive gap in coverage. And I wanted to share one additional point, which we were not clear on at the time that I wrote this report, but I do believe it's very relevant to this process. These individuals who might have been enrolled in exchange coverage for 1 or more months, maybe up to 4 months at this point, and might have, as a result of the reinstatement, dual overlapping coverage with Medicaid or CHIP. These individuals, if they had been receiving APTC through the exchange, will be eligible to have received that. There's not going to be a retroactive determination of ineligibility for those months of dual coverage. So it's our goal to develop a corrective action plan that will provide the option to these consumers to retain their exchange coverage, their subsidized exchange coverage if they wish, because if they've actually utilized that coverage, if they had claims filed that were already paid on, they may wish to retain that exchange coverage for that limited period of time, rather than having to cancel out those claims and resubmit them through their Medicaid or CHIP provider. However, we will be honoring requests for outright cancellation of those policies should the impacted consumers wish to wipe their exchange coverage off the books and get a refund for any premiums or partial premiums that they may have paid for those overlapping months. So I want to pause there, and if it's all right with the board, I wanted to check in with Ms. Weeks to see if you had anything to add to that, or if there's anything that you wanted to clarify or correct that I mentioned.
Stacy Weeks for the record. No, I think you've covered it well.
Thank you, Director. So, Madam Chair, I would like to entertain any questions from the board, or if you'd like any additional detail, happy to provide that at this time.
Do you have any numbers that you have available to share with us on the?
So, Madam Chair, Russell Cook for the record. I wanted to reiterate the clarification that these individuals who were impacted by the reinstatement, the exchange has not received any electronic referrals for these individuals. So we at present don't have any data in our system that distinguishes these individuals who would have been required to self-report a loss of minimum essential coverage. And there's nothing specific about that process that identifies a loss of Medicaid coverage. They would have also had to upload supporting documentation. So the only way that we can identify these individuals in our system, absent some supplementary data from DWSS, which we're working on obtaining right now. But without that information, we would literally have to go in and review each one of those uploaded documents to see which one was a Medicaid termination letter versus some other type of loss of coverage. So in other words, there's nothing to distinguish these individuals from, for instance, an individual who lost employer-sponsored coverage as a result of losing their job. However, just looking at the raw numbers of special enrollment period enrollments of this type over the last 4 months, we estimate that the number of impacted individuals is probably no more than a few hundred on the exchange. So not a significant number of consumers. We think it's certainly well under 1,000, but we'll be happy to provide an update, next time we meet about the status of that. I hope that answers your question. Again,
Very
happy.
helpful. Thank
okay.
you.
All right. Russell Cook again for the record, and I'll keep moving with the lengthiest update, and it's also perhaps the topic that has consumed the most staff resources at the exchange over the past few months. One of the exchange's greatest success stories in recent months involves the continued development of its tribal sponsorship program. In February, the board approved a streamlined certification process for employees of tribal health clinics, allowing them to offer application counseling and enrollment assistance through the Nevada Health Link through Nevada Health Link platform to tribal members and employees. In May, SSX began pilot testing a process for aggregating the monthly premiums of tribal enrollees, allowing tribes who offer premium sponsorship to make a single monthly payment covering all of their members' enrollments. More recently, the exchange coordinated a public comment period approved by the board during the June meeting, which sought to gather stakeholder feedback on the proposed tribal sponsorship framework. The exchange received a tremendous amount of valuable feedback during the comment period, including feedback from tribal health clinics who were experiencing difficulties getting claims for specialist referrals paid for their limited cost share enrollees. As a result, the scope of the tribal sponsorship program expanded to include a recommendation for tribal health clinics to enter into network provider agreements with the issuer or issuers of their choice in order to take advantage of the streamlined claims processing services available to in-network providers. In recent weeks, a number of tribal health directors, including Angie Wilson from the Reno Sparks Clinic, have raised valid concerns which call into question the necessity of these network provider agreements. In the absence of definitive federal guidance on the topic, SSX is working closely with Angie and her legal team to explore whether or not Nevada's tribal enrollees might be entitled to full cost-sharing reductions for specialist referrals, even if the referring clinic does not have a network provider agreement in place with the respective issuer. Lastly, and most recently, the exchange has a meeting scheduled with Nevada's Division of Insurance on Wednesday, the 11th, that was yesterday, to review the current state of our tribal sponsorship program and discuss any potential regulatory concerns that might be related to the contractual relationships between tribal health clinics and the issuers of their choice. We consider the DOI to be a critical stakeholder for this program, and we look forward to keeping the board apprised of our collaborative progress moving forward. And I just wanted to pause for a moment and thank Commissioner Kipper and his team from the DOI. I thought yesterday's meeting was remarkably productive, and we very much look forward to and appreciate the offer for the Division of Insurance to help us assess the claims processing issues that have been reported by tribes. So extremely happy to have your expertise and assistance, Commissioner. I want to close this report by highlighting the efforts of Janelle Davis, who spearheaded the tribal sponsorship program as part of her Certified Public Manager Capstone project, and who laid the conceptual groundwork for the comprehensive framework that eventually took shape. Tiffany Davis, our tribal liaison, who coordinated and scheduled virtually every stakeholder meeting associated with tribal sponsorship, and whose relationships and experience with Nevada's tribal health directors have contributed immeasurably to this effort. Rosa Alejandre, SS6's Navigator Program Coordinator, who almost single-handedly developed the Tribal Exchange Representative Certification Curriculum, and Brooke Mills and Justin Projak from the SS6 policy team, whose expertise and regulatory vigilance have allowed SS6 to develop an extraordinarily complex suite of documents in record time. In my opinion, this project represents the epitome of selfless teamwork, and I consider myself extremely fortunate to be able to lead such a strong and capable team. So if it isn't clear by now, I'm absolutely thrilled at the work that the team has done over the last couple of months. And I certainly want to acknowledge that I would not have applied for the executive director position in the first place if I didn't have total confidence in that team. But I wanted to close by saying that they have exceeded, every single one of them has exceeded all expectations and really risen to the occasion. Many of them are working double or triple duty right now, as a result of staffing vacancies. And I just could not be happier with the results that we've achieved over the last couple of months. And that concludes my report, Madam Chair.
Yes, thank you for the outstanding executive director report. The last part regarding tribal business, did anyone have any questions? That is a little bit complicated. No surprise that there were hiccups when it comes to the provider network. It's always a stumbling block in many plans. We'll look forward to the updates on that as you work through it.
Thank you, Madam Chair.
Any other comments on that report? And Janelle Davis, thank you for the outstanding work. Indeed, capstone work. It was amazing. And indeed, I think all of us just share in celebrating the wonderful access to health through the Silver State Exchange for the tribal citizens in Nevada. So thank you very much. Going on then, now you get to breathe, sir. And going on to the marketing and outreach update.
Madam Chair, this is Katie Charlson for the record. I'm going to give a brief overview of our marketing report, and then I'm going to pass it off to the Abbey Agency to get a little bit more in depth and share a little bit about our campaign. So over the past several months, our main focus has been educating Nevadans on qualifying life events that may qualify them for a special enrollment period, and also the importance of health insurance and getting ready for the upcoming open enrollment. We have done this via social media, email, blogs, community events, public relations, among other tactics. We have also been continuing our public health emergency unwinding campaign. This includes work with our partners at Medicaid to develop paper materials, including posters, business cards, flyers, to pass out to our community partners. We also have continued paid social media ads, organic posts, billboards, public service announcements, and created a new landing page on our website with information on what consumers need to know. The main goal and continues to be update your contact information, educating them about the unwinding and stressing the importance of keeping insurance, avoiding a gap, and to make sure Medicaid members know if they lose Medicaid, that Nevada Health Link is there for them. Nevada Health Link's communication team and our marketing partner, the Abbey Agency, has also been hard at work in developing and strategizing a new open enrollment creative advertising campaign for Plan Year 2024. This open enrollment period, Nevadans can explore 163 qualified health plans offered by a total of 8 insurance carriers. The approach to message consumers from October 1st to the 31st encourage them to window shop and get ready for open enrollment starting November 1st. And then we're going to switch to our larger campaign, Our Plans Are Made for Your Plans campaign. That invokes feelings of having options, plans specific for them, and motivates Nevadans to invest in themselves and their family. Prior to choosing the creative concepts for open enrollment campaign, the research team that we also partner with, Marketing for Change, conducted an online survey consisting of 108 uninsured Nevadans, 111 self-insured, 151 Medicaid enrollees, and 157 employer-insured Nevadans. The goal was to assess the consumer response to potential marketing concepts for open enrollment. They collected data that included emotional response to the creative concepts, general discussion, and reactions to the concepts, as well as recall task tested concept remember most clearly at the end of the discussion. Abbey Agency will go over that more in depth and then go over the results that we got for those. We also included our assisters in that, our brokers and navigators, to get their feelings on our campaign. So as I said, this year we're expanding last year's campaign. Our plans are made for your plans. We are going to be able to reuse a lot of our assets from last year. So very, Clark County centric, showing the city and reusing the local people there. And then this year we did rural, which I'm really excited about. Rural is very close to my heart. I was raised in rural Nevada. So we did our campaign this year in Douglas County and then also Fernley, providing beautiful shots and imagery of rural Nevada. You guys will see that on our sizzle reel at the next presentation. We have a few featured groups. We did a young family of 3, LGBTQ couple, that we did up in Reno, a single Hispanic man, and a pre-Medicare couple. And then on October 2nd, we sent out a press release announcing that window shopping is now open. We announced the average rate increase in the addition of new carriers on the marketplace. And we are planning a press conference on November 1st this year in Reno, and it will feature our executive director, Russell Cook, and other community partners. And then for our open enrollment ad campaign, the Abbey Agency and the Exchange will launch a press release, participate in statewide community events, and implement the full traditional media campaign. The media plan will include advertising in radio and programmable radio, static and digital billboards, Google, online display banners, paid social media ads, broadcast television, connected TV, which is streaming, print advertisements, email marketing, blogs, and social media as always. We are committed more than ever to reaching Nevadans from all backgrounds and communities. More diverse than ever, Nevada has a robust Asian American, Pacific Islander, African American, Native American, Latinx communities. The 2024 Open Enrollment Media Plan integrates highly effective tactics to reach these underserved communities, as well as remaining in the communities throughout the state of Nevada. So throughout, like I said, throughout October, we're going to do our window shopping creative into 15-second ads. And then we will shift over November 1st to our open enrollment campaign, which we will have 15 and 30-second ads. And then as we move towards the end of open enrollment, January 15th, we will, the frequency will increase to help move individuals to take action. We all know people like waiting to the last minute. So we will have a final push then. We are also trying a new tactic of paid out of home paid media. We partnered with a new vendor this year that's going to be at doctor's offices. So in their waiting rooms, they're going to be seeing Nevada HealthLink ads at like jukebox machines at the bar, things like that. So it's really going to be targeting rural Nevada and not just like touristy areas where they're going to see our name and our information. This year, our campaign is really on the nose, and it's really about we offer health insurance. We're going to help you pay for it, see what's available to you, get free assistance. So I'm really excited about it. And yeah, let's see. And to continue to reach our rural communities, we developed an outreach plan that we're going through right now. We have a 3-year partnership with the Food Bank of Northern Nevada to assist in their rural food bank deliveries that will feature Nevada HealthLink brand, resource guides, and other promotional materials. And our navigators will also be invited to these rural food distribution events to interact with the rural communities one-on-one. And then this year, the navigators represented Nevada HealthLink at 169 events throughout the state. Some statewide sponsorships include the Food Bank, as I said, Senior Expo Fall 2023 Series, the Spring Reserve Series, and the Opportunity Village. We do Halloween and Christmas there as well. And then for the website, we did some general updates, but the big one was the navigation, which was getting very full. We have a lot of good information, but it was a lot and it was hard to get through. So we updated the navigation, it's a lot more streamlined. And then we have a new Medicaid Unwinding landing page. We also have a Spanish hub page, which is all of our trans-created materials and pages all together on one page. We'll also have our like Spanish only searching for brokers, so they don't have to even put the filter on there. So that's really exciting, and that's now up and running. We'll be pushing that out through open enrollment. Okay, that's all I got. And then if anyone has any initial questions, I'm happy to answer them. Otherwise, I will pass it over to the Abby agency.
Dr. Jameson, I believe you're on mute. Apologies, Connie Anderson for the record.
Thank you. Great job.
Wonderful. I will share my screen and get started then. One moment, please. Okay. Good afternoon, everyone. Can everyone see my screen all right? Wonderful. All right. I'm Connie Anderson for the record. I am the Abby Agency's Chief Strategy Officer and partner, and our team is incredibly proud to be entering our 3rd open enrollment campaign with the exchange. We have learned quite a bit over the past 3 years, and going into this open enrollment, it has been phenomenal to work with Russell as well as Katie as we dive into who are we talking to, what are the key messages that we need to share with these individuals. They've been great partners in helping guide us to this point. I always feel incredibly lucky when I get to present this work, because it's the pretty work after a culmination of a lot of meetings, a lot of conversations, and a lot of wonderful conversations that really landed us, I think, in an awesome place. Our goal this year is to enroll as many Nevadans as we can. So Katie and Russell both previewed this a little bit, but we are trying new tactics. We're honing in on the marketing. We've honed in on a lot of those key message areas so that we believe we can move people, as we like to say, from awareness all the way down into active enrollment. I would be remiss if I did not mention that we are incredibly proud to partner with Marketing for Change, as well as Erica Avila's Consulting on all of these efforts. They are great partners that help guide us and bring great insights, both from Nevada as well as across the country, to the efforts of Nevada HealthLink. We have a couple overview slides of the research that has been conducted that has helped us identify this creative campaign and messaging. So I'll turn it over to Aaron Metzger of Marketing for Change to talk about those.
Thank you, Connie. Aaron Metzger. I'm the Research Director at Marketing for Change. And as Katie mentioned earlier, prior to the finalization of the creative concepts for open enrollment 2024, we conducted some research, and the goal of this research is to help refine the messages, get consumer feedback on those messages to help us learn a little bit about what is resonating with those messages and what potentially might we want to alter to make the messages hit with our potential consumers. So as part of that research effort, we conducted a survey of 528 Nevadans. As Katie also mentioned, we did oversample for our potential consumers, especially those uninsured, self-insured Nevadans, to really get their insights into how these messages were resonating. And what we do as part of the survey is display the messages for the participants. You can see an example there to the right of one of the messages that consumers were shown. And then we ask a series of questions designed to get how the messages are resonating, the emotional impact, how it affects their intentions, and the types of information it supplies about Nevada HealthLink, as well as potential points of confusion or things that were rubbed participants the wrong way. So here today, I'll just highlight a couple of findings. We had a lot of findings from this research. We also look at all of the findings based on numerous consumer factors such as socioeconomic status, race, ethnicity, age. So just to highlight a few things, we found that messages that highlighted the financial benefits, as well as access to financial support for things such as premiums, were really relevant and motivating across audiences. One unique thing we did find is that with younger consumers, particularly those in that young adult 25 to 34 age range, we found that messages that really equated having insurance with being a more dependable person, they resonated more strongly. One of the things we found is that, again, just to highlight one thing that we found is that the messages sometimes included the phrase middle class, really trying to get consumers in potentially that economic range to know that they might be funding available for them. So we tested that sort of wording. The respondents were actually split on the inclusion of that wording. Some felt it was too vague and felt that it might not be inclusive of them or individuals with lower incomes, whereas other individuals indicated there was new information. Knowing that that was available for middle-income families was valuable new information. So this data helped inform kind of new revamped versions of the messages. So we kind of took this data and then helped the Abbey agency then alter and kind of refine those messages. In the second stage of this research, we actually talked directly to brokers and navigators, kind of relying on their experience working directly with consumers. And for this, we had focus groups. So we talked directly to focus groups of brokers and navigators. They provide feedback not only on the messaging from the eyes of potential consumers, but also provide some feedback on the general shopping experience as they see it for potential Nevada HealthLink customers. One of the things that we found, again, just to highlight a couple of the high-level things that we found, when we asked participants what rubbed them the wrong way or what they thought might be problematic for participants, potential customers, the word private actually was a point of confusion, and many thought that it might, for some customers, might sound off-putting and make it sound like insurance sound a little bit out of reach when we describe the insurance as being private insurance offerings. Lines such as "we help you pay for it," the participants here, brokers and navigators, thought that this would resonate strongly with participants. The other thing that we found that was kind of consistent across the groups is that language that really highlighted the urgency, especially for messaging that might be placed during open enrollment, that really highlighted the open enrollment period was coming to an end. That sort of verbiage really resonated strongly in the end. These participants felt that it would resonate strongly with potential consumers. So again, what we were able to do with this data is present it and then help inform the refinement of the creative messaging.
Thank you very much. Are there any questions about the research portion before I move on?
So it sounds like you had relatively few questions that you provided.
I'm sorry?
Some of the messaging concepts you reviewed with them, it sounds like they were pretty, just a relatively few limited ones?
Right. We actually, in the survey and in the focus groups, we tested 4 different messages. So I have an example there on the one slide. It was 4 different messages that were really designed to touch on different themes and hit on different kind of determinants that might be undergirding desire, the shopping desires of potential consumers. So we did test 4 different versions of those. And again, they helped not only think about which overall message frame was going to be most important, but also were there specific wording or verbiage or kind of like sentence level issues that participants had. Did I address your question?
Yes.
Okay, perfect. Thank you.
Wonderful. Thank you, Erin. Earlier, you heard some reports about the public health emergency and communications to date. In 2022, conversations around the unwinding began, and our team worked with Nevada HealthLink as well as this Nevada State Medicaid Office, as well as DWIS, to put together a plan of phased communications to individuals, so that individuals who maybe were losing their Medicaid benefits would know that this was coming and they would know what to do. So what our team did is launched that initial plan in 2022 with educational messages. And most recently, we launched into an advertising campaign that was very much targeted towards individuals who were at that threshold of Medicaid and may fall off of Medicaid. In addition to advertising, we have done a variety of other outreach methods, including public relations efforts, which was a great collaborative process with the Nevada Medicaid Office, as well as DWIS, where we did press briefings and releases so that we could educate the media in the state about this very large and somewhat complicated topic. We also have done blog posts, social media posts, and then outreach to healthcare providers, as well as businesses who may have a lot of individuals on Medicaid to encourage them to share this information. Linked here is an example of a few of those assets. As I mentioned earlier, there's quite a bit of information. So we like to use animated ads as well as what's called a carousel ad, where somebody who's on Facebook or Instagram can scroll through and see multiple messages. So that top ad is an example of what would be a carousel ad. We have done all outreach in both English and Spanish. It's very important, as you know, to make sure that we are reaching all Nevadans throughout the state. So we have both English and Spanish assets. Linked here is an example of the public relations efforts about the unwinding. If you have been watching information about the unwinding in other states, there has been a lot of negative press. Overall, in Nevada, we feel that the media has been a great partner in helping share this information to Nevadans so that they can prepare and they have the information they need. So you'll see here that we've had a variety of print stories, TV stories, and then also Spanish specific stories and coverage. Again, it's really important for us that all of our efforts are reaching a wide base as possible. So we were very excited and we're very appreciative of the team at DWIS and Medicaid for helping us with this public relations outreach. I'm very excited. If there's no other, is there any questions about the public health emergency assets? If not, I'm very excited to talk about open enrollment strategy and where we are moving to. Our team is consistently looking at what's happening within Nevada, what are Nevadans feeling, and how are we evolving to meet Nevadans where they're at. We always look back at the successes of our previous campaigns, as well as we look at what areas do we think we could improve, and then all of the feedback that we've received. We heard from the board last year how important it is that we are approaching Nevadans with real life Nevadans, that everything they're seeing looks and feels like Nevada. So that was something that was a huge guiding light moving into this year. You also heard that Katie and Russell focused on making sure we were reflecting our rural communities and all Nevadans. So you'll see that in here. We also know that the economic landscape, so to speak, is rough for many Nevadans, right? There's a continuing inflation while it's gone down. It's growing a bit. There's a lot of things that are going on in people's lives. And we wanted to make sure that Nevada HealthLink is seen as a helpful and value-driven resource to these individuals. We don't want to ask them to add another thing to their to-do list because we know their to-do list is long. We want to make sure that we are providing value, that health insurance is bringing value to their life, and that we're doing it at the best possible price. So you'll see throughout these campaigns that we're very much focused on health insurance is something that we, Nevada HealthLink, can provide at a great cost, and it will help bring value to your life. To continue and maintain the main message from last year, we will continue to use the tagline, "Our plans are made for your plans." We think that it allows us to create a lot of creative executions, and it also makes sure that we're putting Nevadans in the middle of this. This is your plan, and we're here to support you and to help you along the way. I just spoke a lot about maintaining the brand, making sure there's continuity. You know, as I mentioned earlier, there's a lot on people's to-do lists. While we have campaigns going year round, the majority of the marketing budget is spent in this 3.5 month period. But there's 9 other months in the year where people may not be hearing from us as much. So having continuity, making sure the brand is highlighted so that there's an immediate recognition is very, very critical. I'll show you this and you'll see some of this in the assets, but we have come up with 3 phases of messaging. This phased messaging approach has been informed quite a bit by research. You'll notice in the window shopping phase, which is where we're at currently, our intro line is, we don't just help you find health insurance, we help you pay for it. We're putting our assistance first and foremost. We're building upon that claim, saying that join the 9 out of 10 who got financial help on their premiums, showing that this is the only place that you can get that financial help. We learned through our testing that the word premiums does speak to people. It makes health insurance stands out to them when we say that word premiums. We then highlight get free insurance and learn about your options, compare plans and be compare plans now and be ready to enroll November 1. So starting again with that date. You'll see in the second open enrollment campaign where we start November 1 and we run through January 1st, there's very much similar messaging, except we turn the focus on to enroll in health insurance by January 15th. We were talking internally. Everyone knows tax day is April 15th. Soon, hopefully everyone will know January 15th is health insurance enrollment date. Katie mentioned we know most people are last minute. So we want to make sure that we're hammering that message so that it becomes just as remembered as tax day. Of course, the IRS has had a long time to build that January or that April 15th day. So we are doing our best and want to make sure that that date is very ingrained in our audience's mind. Something new we're doing this year is we are testing multiple calls to action. So CTA is a call to action when you're on an ad and you're getting that button that says, learn more, click here, click now. That's your call to action. We often use check your price. Check your price is something that is a low barrier to entry. We're not asking you to enroll in health insurance. We're just saying, hey, there are options for you to come check your price. We, however, this year are going to be A/B testing, which means we're going to be running multiple assets where we're going to change that call to action to plans as low as $0, as well as plans as low as $10. There's some national research we're seeing that's showing individuals gravitate towards and are more likely to click on an ad that actually has a dollar amount listed and then we're also learning from that national research, individuals are more likely to click on asset that says plans as low as $10 rather than $0. So that is very interesting. We're excited to test that and report back in real time. How are people reacting to this message? The deadline message, again, is very similar. We're talking about price and value, though we change the main message to the right time to get health insurance is right now. We're encouraging people to act before enrollment ends again on January 15th. And then we will develop that call to action. Oops, with that pricing message when we learn what works best during that initial month of open enrollment. All right, so now for some exciting things. Katie mentioned this earlier. We added much more video into the window shopping time period. On broadcast, we have the opportunity, like TV, we have the opportunity to do a lot of awareness messaging during this window shopping period. And then on digital channels, buying video assets is very cost effective and helps with our impressions overall. So we are excited to add video to this window shopping period. So I'm going to play an example of one of those videos right now.
NevadaHealthLink.com. Welcome to a health insurance marketplace built for Nevadans. We don't just help you find health insurance, we help you pay for it. Join the 9 out of 10 Nevadans who got financial help on their premiums. Compare health insurance plans now and be ready to enroll on November 1st. NevadaHealthLink.com. Our plans are made for your plans.
So very fun, energetic video there, as you saw, using a lot of the Nevadans from last year as well. Here's a couple examples of the assets that are running currently to support window shopping. I now want to give a preview of what we will be sharing starting November 1st. This is a sizzle reel. So what this does is it brings together quite a few of the new assets that we gathered. This is not the full commercial yet. That is still being edited. I will share with you the video script shortly. This is simply the sizzle reel, which shows the new LGBTQ couple that we gathered, as well as additional rural scenes. And then it shows a new how do we call this, but almost an interactive element that we've created in these assets. You'll see very shortly, but we have a almost 3D moment where these actual characters and Nevadans interact with the different health insurance logos and options that we have throughout the state. Again, as Katie mentioned, we really are trying to hit the nail on the head here with Nevada Health Link is here for you to get health insurance. So I will play this video now. Wonderful. And I can send out the link to that as well, if the sound didn't work for some individuals, but I think shows the great depth and variety of the new assets. And so we thank the Nevada Health Link team for continuing to push us in this direction. And we're very excited to add new individuals into our assets this year.
I didn't get the sound, so I'd appreciate the link. Perhaps you would just send it to every board member. Thank you. And
Absolutely.
it looked fabulous, and your 3 phases messaging is just on the money. Excellent.
Thank you so much.
I didn't get the sound either, so
Wonderful. We will post or send out a link to the video so you can hear the sound.
thank you.
Wonderful. Okay. This is the video script that will go along with the full video ad. I'll read it to you shortly, and it says, "Welcome to a health insurance marketplace built for Nevadans. At NevadaHealthLink.com, our plans deliver financial help for qualified Nevadans, a variety of health and dental plans, and free assistance navigating your options. So you can fulfill your plans and focus on what matters most, with coverage that you can count on. Because at NevadaHealthLink.com, our plans are made for your plans." So we think that really sums up very nicely the price as well as value message. Here's examples of the new print ads. We are, again, very excited to add these individuals throughout the state. We love seeing more logos across the bottom of our assets as well. So kudos to the team for expanding the network and options for Nevadans. Here's an example of a billboard that will be running during open enrollment. It's very simple and to the point. I think you'll see that reiterated throughout our messaging. We want to make sure that people know that if they are looking for help, we are there to provide that help for them.
Great message. Who isn't looking for help to get their health insurance?
Yes, exactly. Great. Thank you. It's very simple. We'll do a few more executions of this where we have some supporting graphics that will go around the logo. But when you're driving down the road, as many of you do, you have very few seconds to see a billboard most of the time. And so brevity is critical when looking at a billboard. Simplicity, I think, always does well on a billboard. Here's an example of a digital ad for open enrollment. This will be animated as well as a carousel. So again, one of those that you can swipe through. The messaging I shared earlier is what is on this ad. Here are some of the video or photos. They very much warm my heart every time I get a look at these photos. They, I think, really help to bring life to the campaign, as well as the value of health insurance and how it empowers you to do what you want. These will be across the website, across social media, and our newsletters and other content that we have. So here's some more examples of those photos. Now down to the nuts and bolts a bit. Paid media is critically important. This is how we are reaching new audiences to bring them into the fold. Russell mentioned earlier, we expect to have about 74,000 re-enrollees, but we want to have at least 20,000 new enrollees. We'd love to get to that 100,000 mark again. So we need to bring in many more than 20,000 new people who can look at their options, decide what's best, and enroll. So our paid media strategy is one of those that really helps to create awareness of the importance of health insurance. And then, of course, how Nevada Health Link as the official place to go and get financial help on their premiums. We will do a variety of tactics. A majority of our media buy will be going to traditional outlets. Traditional outlets are things such as billboard, broadcast TV, cable TV, newspapers, different things like that. They do continue to help us with that brand awareness. We do also have a strong digital focus, though. We're very excited that through our digital ads, we are able to continue to target people more and more directly so we can be very efficient with the dollars that we have. This year, as Katie mentioned, we're trying a few new things. One of those is Nextdoor on digital advertising. I'm not sure how many of you are on Nextdoor, but as an app and a website where you can connect with people directly in your neighborhood. So to join Nextdoor, you have to get a code into your mailbox, and then you can speak with the people directly in your neighborhood. So we can do advertising on there targeted towards throughout the state, both rural and urban areas. So we're excited to try that out. We will continue to spend quite a bit of money on our search engine marketing. So that's Google and Bing. We've been learning that a lot of people coming to Nevada HealthLink's website use Microsoft Edge search to get there. And so Bing and then Edge advertising is very important. We also, as you know, every year there are quite a few of the scammers or the other people who are selling disaster insurance that aren't quite Nevada HealthLink imitating us. So we go head to head competing with them on those search engine rankings. We also, as Katie mentioned, will be doing out-of-home digital in hospital screens, rideshare screens, different places like that, so that we're reaching people across their day. Public relations continues to be a very, very important part of our strategy moving forward. As I mentioned earlier, the media continues to help share the story of health insurance, and we want to make sure that we are great partners with them. Very shortly, just next week, we will have 2 prep rallies for our broker and navigator communities, and we hope that you'll be able to join them. Monday, we will be in Reno in person hosting a prep rally. Wednesday, the 18th, we will be in Las Vegas hosting a prep rally. After the Las Vegas prep rally, we are holding a public resource event that we are calling Ghouls, Ghosts, and Getting Insured. It's the season, of course, of spooky things. So that will be at the Alexander Library in North Las Vegas. We're partnering with a city council member in North Las Vegas who will be attending and sharing this. The city of North Las Vegas has been a wonderful partner in sharing out information about this event as well. This is one of the first times that Nevada HealthLink has hosted a more public-facing event for the community, and we're really excited to have the opportunity to do so and speak with consumers directly about the value of health insurance. November 1st, we'll have a press conference in Reno. Last year, the press conference was in Las Vegas. So we want to make sure that we have equal representation across the state. So we will have our press conference in Reno this year. It will be live streamed. We are very excited that we have a member of the governor's team confirmed to be a part of that. And then we are working on also a proclamation to recognize November 1st as Nevada Health Coverage Day, which I think is a phenomenal next step in really establishing how important health insurance is to Nevadans. We have done quite a bit of community relations. Katie mentioned earlier, over 160 events this year. We continue to look at making sure we are making the greatest impact with our events. We have updated and improved the different collateral items handed out. And then we're also pursuing library partnerships, both in urban areas as well as rural areas. And so the Alexander Library in North Las Vegas is a start to that. But those library partnerships look like sometimes hosting events, sometimes having our posters and different collateral materials inside those libraries so that we're reaching community citizens who are there. Here is a couple of events that we have completed or been a part of recently, as well as photos from those events. Listed on the left are a few upcoming events. So Rosa, Griselda, and the team are very busy coordinating our navigators to get out and speak with our community, and we are so thankful for their support and partnership in that effort. Multicultural communications remains very important. For us, we want to make sure that we are reaching all of our audiences wherever they're at. So we continue to work with stakeholders who speak multiple languages and encourage them to use our toolkits, as well as the information we have to better service and provide that information to the individuals they work with. So examples of some of these partners we've worked with are chambers of commerce, nonprofit organizations, as well as consulate offices throughout the state. We also are working with elected officials to help develop scripts and videos that they can share on their own communication channels, or perhaps in Las Vegas, the city of Las Vegas actually has their own TV channel, as many of you know, where they can share video PSAs on those. So we've conducted outreach and are working with specific targeted elected officials on that. We also continue to work on contributed content, and what that means is either blog posts or social media that can be shared with these organizations and help reach their audience members. We are, as Katie mentioned, very excited that the new Nevada HealthLink en Espanol page has gone live on the website. If you go to nevadahealthlink.com, in the very top row, around the middle of the page, there's in gray, it says en Espanol, and you can click on that. And that provides a great resource for any individual who speaks Spanish to see all of the information that they may need to help enroll. And if they don't find the information they need on that webpage, there's many calls to action to call someone or to reach out to a broker directly who speaks Spanish. We will work to do Facebook Lives with many organizations because that provides an opportunity for individuals to engage. And then we'll continue to make sure that we are targeting key dates that matter to many different audiences. So that's things like Day of the Dead, Black Friday, throughout the holiday season. Content strategy for content, what that means is what information is going onto the website, what information is going into our newsletters, and what information is going onto social media. All of that helps support how high we rank on Google and Bing. The higher you rank on those search engines, the better. If you think about how you engage with Google or Bing, if you're looking up, coffee shops near me, you're often most likely to look and click on the thing that shows up first, right? That's usually a trusted resource. It means that many people have been there. NevadaHealthLink.com ranks #1 on many and most search terms related to health insurance. We want to make sure that we continue to rank 1, 2, 3, 4, and 5. And the only news you can find, of course, about health insurance is Nevada HealthLink when individuals are looking to enroll. So we do that through a content strategy. One new thing that we launched this year on our content strategy is a community newsletter. So that community newsletter goes out to our partner agencies throughout the state. It goes out to organizations that we've sponsored. It goes out to other stakeholders such as municipalities throughout the state, chambers of commerce throughout the state, individuals who need to know what's happening with Nevada HealthLink so that they can share it with their members. So that is a new initiative that started at the very end of last year's open enrollment, and it will continue throughout this year's open enrollment. Social media is something that is critically important to reaching our audience. We have focused immense amounts of efforts in the past 6 months to grow our social media following, and we have seen a great growth month over month. We will continue throughout open enrollment to engage them through doing FAQs, through providing information on how to reach out to brokers and navigators, really highlighting the 10 essential health benefits so that if they see maybe a scammer or getting outreach from somebody who is not Nevada HealthLink, they'll know the value of plans on Nevada HealthLink because they cover those 10 essential health benefits. We'll continue to focus on video. Over the past 3 years, we have amassed quite a library of video of Nevadans who are out in the community. And so we'll continue to share that because video gets great engagement. So that is our plan for open enrollment this year. We are very thankful to all of our partners within the Nevada HealthLink team, as well as Marketing for Change and Erica Aviles for helping put together this great campaign. And we are so excited to share the results with you. Are there any questions that I may answer?
Great campaign, and you guys really did amazing research. I think, I had a few questions. What do you guys consider middle class these days?
That is a great question. And I think Aaron could speak to that messaging and why we tested it.
I kind of was surprised you tested that with our population.
Yeah, I think that is a really good question. I think that one of the goals is to let people know. I think that letting them know that there's availables for potential subsidies if you are a family, have multiple dependents, and then that can influence your eligibility for some of that subsidies. So really kind of expanding the potential audience to include families that, might not consider themselves eligible for some of these programs, but making sure that they, that if they see themselves in middle class, they, know that they also might be available for them.
That is such a great point, because yes, it is the perception that we are the lower income, and yet we have the range indeed for the lower end of middle class. There's no question. And that is fascinating. How can we reach them? Yeah, that's excellent. I see why you wanted to put it out there. So and so getting back to the population, we do have quite a large number of the Latinx, Spanish population. Do you know exactly what percentage of our enrollees are Hispanic, Latinx? Out of curiosity, I can tell you that sometimes when I'm on websites, when I go to something that's out of our country and it's not in English, of course, I wouldn't get past the first page. So I am so excited about our Nevada HealthLink Espanol, because it's really fantastic that we have this rolling out this year. It's just amazing, because it's amazing when you think about it that we've been going 4 years without this, considering how many Hispanic, Latinx enrollees we do have, and that they've navigated it, which they have probably become very skilled at, since much of what they might participate in don't always offer them in their own language. So just bravo, bravo, bravo. I think this could help us get those extra 20,000. I just think it's just so fabulous. I cannot tell you. So what do you have there for the numbers?
We can look at, and we may want to defer to the Nevada HealthLink team on the current enrollees that are Hispanic or Latinx. I do know in the application process, it is not required to report race or ethnicity. So there is a large population of individuals who do not report that. However, of the reported individuals, it would probably be best for the Nevada HealthLink team to say how many enrollees are self-report as Hispanic.
And how many of our navigators and brokers do we check? How many of them actually are bilingual with Spanish?
This is Katie Charleston for the record. We do check, and I can get you an updated number for this year. I want to say last year we had a little over, sorry, I bring my baby to work, so she's part of the meeting. But we're about 150 brokers that offered Spanish services as well. And I can get you an updated number for this plan year.
Excellent. And just with our marketing PR group, when they're out at our events, I imagine, is there just a significant small majority of the Hispanic population, or are they literally literally a majority? I mean, that come to the events?
Every event is different. When we look at our events, we work with Rosa and Griselda
Oh,
to identify,
sure.
is
Yeah.
this an event where we expect a large Hispanic population or Spanish speaking population to attend? Then let's have navigators there who serve that population. Or is this more of a general market event? So we're always looking at that as we engage and decide our events. We do make a concerted effort absolutely to reach those audiences.
An amazing effort. An amazing effort.
I mean, yes, we speak with the navigators do a great job of speaking with many individuals. They do provide post-event recaps. They don't track who they speak to in English or Spanish, but it's something that we could get some feedback on for future. Absolutely.
I know when we saw the printed material and some of the digital material, I was almost not keyed into it, but I can flip back through it now. So it's all, I know, in both English and Spanish?
That's correct.
And I wanted to compliment you on the printed and digital with the QR codes right there, because that's all they do now. And that is fantastic, seeing it on your materials here.
Thank you.
And on the North Las Vegas prep rally, press conference in Reno, you mentioned the date, November 1, it'll be the kickoff date?
That is correct.
And I apologize, I might have missed an email. Did you send information out to all of us board members about that?
We will do so shortly.
Because schedules are so busy, we have to kind of put it ahead of time if we hope to come. And the conference in Reno, where was it being held? I saw you talked about the library for later for the ghost, etc. But was the press conference going to precede that in the same location? Different location.
Yeah. So October 16th in Reno is the prep rally. That's
okay.
That is at Tamarack Junction. October 18th in Las Vegas, the prep rally will be at the East Las Vegas Library. We will then move in the afternoon of October 18th to the Alexander Library, which is in North Las Vegas. So 2 events, 2 libraries in Las Vegas on October 18th. And then November 1st,
the press conference
in Reno, and that is at the Northern Nevada Public Health Office.
Yeah, that's the one I didn't really know where that was. Northern, so it's at the Public Health, similar to how you did it last year.
Yes.
At the Public Health. And the time?
We are asking people to arrive at 10 a.m. on the 1st of November.
Was there any other questions on some of these details from our board today?
Madam Chair, Tiffany Davis for the record. I did just want to mention, I know Connie spoke about the sizzle reel. I know majority of us, I don't believe were able to hear that. So I did just for the record want to mention for not just the board members, but for everyone listening in and for the public, we will be posting that sizzle reel on our website so that everyone can see and hear that.
Very good. Just great work from our PR and marketing team. Just amazing. Any other comments from our board members or anyone on the presentation? Again, awesome with the Nevada Health League Espanol. I think that's going to put us over the top of our projected, our hoped number of enrollees. I just think it's fantastic.
Thank you. We hope so as well. Absolutely.
So if there are no other questions, gosh, we can just proceed. I don't know, Tiffany, you can always see everybody's hands better than I can. I don't want to miss anyone.
Yeah, Madam Chair, Tiffany Davis for the record. I'm not noticing any hands at this time.
Okay, so we'll move on. Again, I just have to say excellent, excellent work. So going on to discussion of possible action regarding dates, times, and the future meetings. Did we have any follow-up that our board would like to see on the agenda for our next meeting? What is the date of that next meeting, Tiffany?
Madam Chair, this is Russell Cook for the record. I'd be happy to share that information with you. And what a team, huh? Really good.
I know. It's
yeah.
really, really amazing.
So our next scheduled board meeting is Thursday, December 14th at 1:30 p.m. And the board will be reviewing and considering for approval our next fiscal and operational report.
Fabulous. Fabulous. And so I think for me, I'm just looking forward to hearing follow-up about the tribal Indian and out-of-network providers, how you guys are going to deal with that. I'll be looking forward to hearing how our enrollment will be going, of course, not that you'll have any kind of, we'll be in the midst of things, but I will be very much looking forward to hearing about that. Was there anything else that our board members would like to have our amazing staff at our exchange give us an update on? It sounds like you have answered all their questions. You have done a beautiful job of bringing so much wonderful information and updating us on what's been going on. Thank you so much. And so I guess we can actually, if there's nothing else under discussion for the dates, times, and agenda items, we can go to public comment.
And yes, Dr. Jameson, Tiffany Davis for the record. I'll help facilitate the public comment. Just a reminder for anyone who is on the line, if you would like to make a public comment, please do so by raising your electronic hand in the Zoom as a Zoom feature, or indicate in the chat box if you'd like to make a public comment, and we'll let you know when you may unmute yourself for that. So I'll start with our conference room in Carson City. Cassie, do we have anybody in our physical location who would like to make a public comment?
Cassie Fuentes for the record. There are no public comments in the Carson City location.
Thank you so much for that confirmation, Cassie. And then, Kaylin, do you see anybody online that has their electronic hand raised, or any comment in the chat feature where they would like to make public comment?
Hi, Caitlin Boyden for the record. I do not see any hands at this time, Tiffany.
Thank you, Caitlin, for that confirmation. And do we have anybody on the phone lines? If you are on the phone line and joining us that way, you would like to go ahead and unmute yourself and make your public comment at this time? Not hearing any. I'm going to assume that there's no one on our phone lines to make public comments. So, Madam Chair, it does not look like that we have any public comments at this time.
Just want to thank everybody once again for the amazing from the staff, our PR and media marketing team, everybody. It's just amazing everything you have accomplished. And I think at this point, then we'll just entertain a motion to adjourn.
Madam Chairman, this is the one move, I'm moving to adjourn.
Valerie Clark, second.
Thank you, Yvonne and Valerie. And everyone in favor of ending our meeting? Aye.
Aye.
Aye. Aye. And thank you all for again coming here and spending these very precious hours. It is so appreciated by those people who really need this amazing exchange where they are doing their best so that their plans are accommodated with our great plans. And I think that it's so important to listen to what my husband always says, compassionate listening. Our director started off with that word compassionate, and this team has been compassionate listening from our exchange to our board so that we can provide the absolute best for our Nevada citizens who really do need help affording their insurance in this world we live in today. So thank you all so much for your time coming today, and have a great weekend.
Thank you. Same to you.
Thank you.